Well, my subject this morning is the itchy dog and cat, a little bit of the cat, mainly on fleas and sarcoptic mange, diagnosis and treatment. Because pruritus is the veterinary term for itch. Notice how it's spelt, US at the end, not itis, it's not pruritus. Most vets spell it pruritus. So the main causes of pruritus in dogs and cats are fleas. 50% of dogs and cats that are itchy will be itchy because of fleas. Other parasites, such as Sarcoptes scabiei, for example, which we're going to talk about later, Varcanis, the dog one, ear mites, Caletiella, lice, are important causes. Another important cause, which we won't deal with today, is the disease called atopy, which is the same as hay fever in us, caused by allergies to pollen and house dust mite in particular. Allergies to food, a little bit controversial. We're not sure how common that is. Most vets find it difficult to diagnose, so they call it uncommon, whereas specialists diagnose it more commonly. And then, whatever the cause, and there are others, we tend to get secondary infections with bacteria and a yeast called Malassezia. So there's a lot of things that can cause a dog and cat to be itchy. But I want to talk about the flea, because this is the most important one, and in particular the cat flea, Gatenocephalides felis. Very successful, very clever. 99% of fleas on dogs are cat fleas. The dog flea, Gatenocephalides canis, is in danger of extinction. And why is that? It's because the cat flea is developed over billions of years to survive very well. And to get an understanding of that survival, I thought I would take you through the life cycle of the cat flea. Now, it's not something you've probably thought about much, but it's an understanding of the life cycle that is the key to understanding all the things that can go wrong when we try to control them. The female flea lays up to 50 eggs per day, so she's pretty prolific. And this is what they look like, very similar to what you had for breakfast, except these are magnified, obviously. And they look slippery, and they are. The female flea lays these eggs, particularly at night time, when the dog or cat is sleeping, and they roll off into the environment where the dog likes to sleep or rest. They then hatch out, and what we have here is a scanning electron microscope of a flea larva hatching out from the egg. And that white thing, I don't know whether I can show on here, doesn't show very well, but the white thing at the edge there is called the egg tooth, and it hammers out of the egg shell. The big white thing is the egg shell, and the larva is hammering its way out to hatch. A clever scientist from a drug company called Novartis worked out that because the flea exoskeleton is made of chitin and the egg tooth is made of chitin, if you give them the dog or cat a drug called lufaneuron, that interferes with the synthesis of chitin and makes it very soft. We are having a bit of an alteration here. How's that? Is that an improvement? Not quite. Not everybody gets personal attention. I'll put my belt on too tight. How's that? How's that? No? Or use this? Okay, so I'll use this one. Is it on? No, yes, I'll use that one. Is it on? Well, this one. What about this one? How about that? Can you hear me at the back? Put your hand up if you can. Are they hearing me at the back? Yeah. That's fine. Okay, so here we are again then, after significant alteration. We have the larva trying to hammer its way out of the egg, and if the animals had leufoneuron program, it can't do it. So in a way, when you feed a dog or cat this drug, you are effectively putting the female flea on a contraceptive. The eggs are going to be infertile. When they do hatch out, this is what the larva looks like, and it needs to feed on blood. If it doesn't feed on blood, then it's going to die within 24 hours. But the female flea has thought about that. She produces the food that this larva is going to feed on, and she does it by drinking lots of blood and then passing it more or less straight through her digestive tract as flea feces. And what you're looking at here is a female flea feces. The little black dot to the left is an insignificant male feces. It's the female that does all the work in the flea world. And so then the larva molts 3 times and becomes a pupa. And the pupae like to be in the crevices of the carpet, and they surround themselves with dust and detritus. And there you see a group of pupae in the place that they like to be, which is in the bedding or carpets of the house. And then the miracle happens. Over the next week or so, you get a metamorphosis into the flea. And this is what a flea looks like before it hatches out of the pupa. Now, the flea's not stupid. It must, like the larva, feed straight away. It needs to feed within 24 hours of coming out, or it will die. So it doesn't make sense for it to just hatch out. What does make sense is for the flea to hatch out when it knows that there's going to be something to feed on in its environment. So how does it know there's going to be something to feed on? Well, these are called trigger factors, which help the flea to emerge from its pupal case. And these trigger factors are vibration, a light variation from a moving object, I'll explain, warmth, and finally carbon dioxide. So if you're a dog or a human being, and you walk across the carpet like this, vibration, out they will come. If you pass by a light there, and they see that light, out they will come. So light variation, vibration. The dog gets into its basket, it's nice and warm. Carbon dioxide, and that triggers rapid, very rapid emergence and jumping. Now they don't, when they know there's a dog or cat around or a human being, they don't sort of have a look and think, oh, there's something to eat around here. They come out very rapidly. So here we are, all tensed up, ready to come out. Lift off. There's the flea charging out of the pupal case, flying through the air, looking lean and hungry, and landing, it hopes, on a food source, which in this case is a human being, and immediately starts to feed. So the difference between the lean and hungry and the well-fed flea is obvious to see. And they can jump. I mean, people have measured flea jump records. So the longest that a flea can jump is 45 centimeters, and the highest it can jump is 25 centimeters, which is the equivalent of me jumping over the Eiffel Tower in Paris. So they are the Olympians of the insect world. And of course, that 25 centimeters is interesting because it just about gets to your ankle. So if you walk across the carpets in a house where there's lots of fleas waiting to come out, they will come out quickly and jump and land on your ankles. And if you have an allergy to flea saliva, then you will get a spot or an itch on your ankles. So I always used to say to myself and to the clients, anything below the knee is likely to be the flea. What fleas can do, apart from the diseases I'm going to talk about, is that they do drink a lot of blood because they need to provide food for their offspring, particularly the female flea. And in a young kitten like this one, with a severe infestation of fleas, it can cause severe anemia and death. And this, what we're looking at is the mouth of a kitten, and you can see that tongue looks very pale. It should be very pink, like a salmon. But the main cause of problems that we see, in fact, the only real problem that we see in skin disease is allergy to the flea saliva. And here we have a scanning electron microscope of a flea's head, and you can see that it's got that nasty mouth part which it uses to enter the skin, inject saliva, and suck the blood up. And it's the injection of the saliva that causes all the problems, because animals, including us, very easily develop an allergy to that saliva. And so where do we see the disease on dogs? Very typically where you can see them here. The fleas have worked out over billions of years that if they feed mostly at night time and feed around the back and the base of the tail, it's a little bit more difficult for the dog to get rid of those fleas from there. There's a better chance of survival. And so when we get hypersensitivity, the dog will scratch and lick and rub in the area where most of the feeding is going on. And so you get a very typical picture. This is so typical of flea allergy. Any vet that looks at that will say that's a 95% possibility of being flea allergy. And it is flea allergy until proven otherwise. Here's another one in this dachshund here. You can see this is more chronic case. This has come in as a second opinion, and the owner, when we questioned them, has not done the treatment properly. And this is the essence of my talk as far as fleas are concerned. The big problem is compliance. In the English language, particularly in medical language, compliance means, does the owner or the patient do exactly what the vet or the doctor wants them to do? If you don't finish off your course of antibiotics, and most of us don't, let's say, then our compliance with that is poor. The compliance with flea treatment is often poor and is one of the results why the problem continues. The other reason the problem continues is because the animal's itchy, it licks and rubs some of the fleas away, and you can't see them so easily. If the owner can't see the fleas, they won't believe the diagnosis. We all know that cats are not like dogs. They are different when it comes to flea allergy. The most important example of flea allergy in cats is miliary dermatitis. And here we have an example. It's in the same site as the one you've already seen. And I don't know if you can see from where you are, there's lots of little red dots there. These are called the miliary dermatitis. Comes from the Latin from milium, meaning millet seed. And with miliary dermatitis, you can palpate these little papules and crusts. Again, you won't see many fleas because the cat will be licking them off. The cat will also show the same disease by just licking. Years ago, we used to think that this disease you see here, which is bilateral alopecia, bilateral baldness, we used to think that was a hormonal problem until we realized that actually it's an itch problem, and the cat is just choosing to lick furiously at where it itches most and is causing the hair to come out. And you can see on the left-hand side of that slide, near the hand, there's licking up there as well. So it's not just at the back. So flea allergy in the dog is easy to diagnose. Flea allergy in the cat is trickier because they show different ways of the same disease. So when we want to control fleas, what are the aims of treatment? This is very simple, deceptively simple. We want to kill all the fleas on all the animals in a household. To do that, we need to use a licensed product, and these days, virtually all the products are spot-ons. A new treatment's just come out, which is a tablet, which may well deal with compliance, because all you have to do is feed the tablet once a month in the food, and that will do the job. The important thing to do is to follow the manufacturer's instructions. It doesn't matter what product you use. I'm not going to bore you with a list of all the products, but the most important thing is that it's a licensed product and you follow the instructions. And most of them, you treat the animal monthly. To get around the compliance, or to help with the compliance, I always advise do it on the first day of each month. And if you do that, and this is the key to it, you prevent the build-up of fleas in the house. Often when an owner comes to you, they've already seen fleas, and there are lots of the other things I've shown you already in the environment. Ideally, you want to start treatment before the flea season. In temperate countries, that's going to be early spring, and treat throughout every month throughout the early summer and autumn, so that any fleas that jump on the animal are killed before they can lay eggs. This is the mantra that all the manufacturers say: our product kills fleas before they can lay eggs. And this is, if they do that, then when the animal goes to its bed or its home, it's in a flea-free environment. And this is what we're aiming to get at. You can't get rid of all the fleas in the gardens outside in the summertime, but you can certainly provide a flea-free environment in the house. And we are spoilt for choice these days. Fipronil was the first modern spot-on. It's called Frontline, but that patent ran out a year or so back, and now there's at least 17 generics. Generic means that it's a product that any company can make once the patent of the first product has run out. Other spot-ons are coming out all the time, each one of them trying to get a bit of the market, which is a big market. Beef-flavored tablets, these are the latest. I think this is probably the future for flea control, where you give them a tasty tablet in the food. The one that's come out recently is called Comfortis, and that one kills fleas within 4 hours and then provides protection for a month. So all you need to do theoretically is to give them that tablet on the first day of each month, and that is as much as you can do to control fleas currently. But the important thing is that if you follow the instructions, all of them work pretty well. They particularly work well for just a flea infestation. With the flea allergy, you want something which kills them quickly, and that's why I particularly like the tablet. So much for fleas. What about Sarcoptes scabiei? This is a scanning electron microscope of a female Sarcoptes scabiei, the cause of sarcoptic mange or scabies in dogs, humans, virtually any animal. And this is a female because it's got these spikes on its back. And this is a clever thing to do because the female, again, does all the work in reproduction. She burrows in the skin, laying her eggs, and the spikes prevent her from falling back in the burrow. So she goes forward, continually forward, and doesn't slip backwards. Most vets don't have a scanning electron microscope, so this is what they look like when you do a skin scraping. And this is how we diagnose scabies in dogs. We do skin scrapings, and the fun of it is to work out where they're likely to be and scrape in the right places. We put some liquid paraffin on the right places, scrape with a scalpel blade, and put that onto a microscope. They are difficult to find, and the reason for that is that, again, like the flea, the disease is caused by a hypersensitivity to the mite. So if you find them, that's really good. So here we have Mum on the right-hand side and Junior wondering what's going on, trying to find his mum, the larva on the left-hand side. The other diagnostic feature is to find eggs. The eggs are absolutely characteristic, and not only are the eggs characteristic, those little black dots you can see underneath the egg on the right-hand side, those are mite feces, which are absolutely typical in Sarcoptes scabiei. If I find those pellets in a skin scraping, I'm pretty much made the diagnosis. Scabies in dogs, it's the most itchy skin condition that we know. Normally when I'm working up, trying to investigate an itchy dog, the first thing you want to ask the owner is, how itchy is it? And we do that by suggesting to them that a dog that never scratches at all, doesn't scratch in the daytime, nighttime, isn't scratching in front of us now, is 0 out of 10. And a dog that scratches all the time, keeps himself and the owner's awake, is scratching in front of you now, that's 10 out of 10. The thing about scabies is it fools our fellow vets initially because it looks like an allergic skin condition, atopy. 3 or 4 out of 10 once it starts. But the key to it is that if it's not treated, it gets worse and worse. And this is a dog that was not diagnosed some years ago and came in to see me. It's got quite severe facial lesions, as you can see here. And note the lesions on the ear. Those are very important in scabies, and they're different from the other form of mange, because you don't tend to get the lesions on the ears in the other forms of mange. But in scabies you do, and here's a close-up of the ear, the pinna. And one of the diagnostic tests for scabies that you might try in your shelters and your kennels, if you see something like this, is to get hold of the ear and rub it like this. And this is what happens. If you do that, the dog will scratch. Do this, and the dog will scratch, and that's pretty much diagnostic. It would mean to me that even if I didn't find the mite, I would treat the animal anyway. It's that until proven otherwise. And these cases, if we don't get on top of them, sometimes they come to you in a really bad state. And here we have a golden retriever that is literally eating themselves. And this is where the term mange comes from. It's from manger, which is, many of you will know, is the French for to eat. So this is one of the diseases that's been described since antiquity, and it was a sort of skin-eating disease in old times. And I've got my friend here to do some more alterations. We're going to try and get this dog to scratch. Can you make that? That's it. Good. Thank you. This is what we mean by 10 out of 10 itching. This is a dog that was sent, picture was sent to me recently. It already had demodectic mange, but what they didn't realize was that it also had sarcoptic mange or scabies. And in the consulting room, it was scratching 10 out of 10. And that, to any vet, should... Yeah. No, don't need to redo it. Just go to the next slide. Yeah. That for any vet, scratching like that it's going to be. There's not many diseases that will scratch as bad as that. And if we don't treat these cases, they can cause fatality. And here's a dog that came in years ago, dead on arrival. And this is a tragedy because actually, if I get them in alive, I don't think I've ever failed to cure a case of scabies. It's a fantastic disease to diagnose because it causes such suffering, a fantastic disease to treat because mostly you're going to be successful. A fantastic disease to diagnose and treat, but you need to get it in time. Foxes are a focus or reservoir for the disease in the United Kingdom, and it's very often a cause of fatality in them too. And this is the case of a fox that's been brought in suffering from generalized scabies. Foxes are everywhere in London, including in Trafalgar Square in the centre. They are a real large number of them. And of course, scabies, as the flea can cause problems in us. This is a close-up of a woman's breast. These days you can't show the whole picture, so believe you me, it's a woman's breast. And she had the dog resting its head on her breast, and the mites from a dog will bite us. They won't live on us, but they will cause quite a bit of itching. And when I see a case, I normally refer them to their family doctor, but tell them that the disease from the dog is different from our disease. Our scabies is much more generalized, whereas if you get it from your dog, it's normally where you have contact. And if you take the dog away and treat it, you get better without any real treatment. Which brings us on to the subject of scabies treatment. We are spoilt for choice with products. We use licensed products. And I should explain to you briefly what licensed means in the United Kingdom, is that when we make a diagnosis, we are obliged as vets to use a product which is licensed for that particular disease. That product will have been developed, it will have had clinical trials to show that it is effective and also to show that it is safe. And so by doing that, we know that we're using a product that's going to work. So we're obliged to use those products, and we only use unlicensed products when the licensed products don't work. So selamectin is the one that I usually use. This is a spot-on, which you apply monthly times 3. And I think it's such an important disease that I never leave that to the owner. Even if the owner is phenomenally intelligent, they can still have trouble applying it properly. So I like to do it myself or get one of the nurses to do it so that you know it's been done properly. And that gives you the opportunity of looking at the animal once monthly. Another one that's effective and also has a license is Advocate. This is a spot-on applied every 2 weeks. 3 applications is normally advised. That's licensed too. Lime sulfur, a shampoo, weekly times 4. These days I don't tend to use shampoos. They're messy, they're smelly. Another one is Amitraz, Aludex, which we also use for demodicosis, at half the strength, 250 parts per million. I don't really use that very much these days either, because the first 2 in particular are very effective. You may have heard of ivermectin. This is a drug which is very commonly used all over the world. The Americans sometimes call it vitamin I. This is a drug which you can give by injection. The dose you see here, 0.2 milligrams per kilogram, subcutaneously, and it is quite effective. The problem with it is that it kills some dogs, particularly sheepdogs, collies, Shetland sheepdogs, anything with a long nose, anything that has anything to do with sheep. They can't pump it out of the brain, and so you get severe brain problems, ataxias, falling about, fits, and death in some cases. I don't use this drug at all for scabies. Sometimes use it for Demodex, but for scabies I don't need to because the other products are so effective, as you will see now. So here's a dog looking pretty anxious, scratching, not much hair on it. The diagnosis hasn't been made, and you have to do lots of skin scrapings and be patient to get a diagnosis on these, or if you can't find the mite, then you just treat them anyway. This dog was given selamectin, so here we are 6 weeks later, looking much more comfortable, and 12 weeks later, we've cured him. And this is the great thing about this disease. It's lovely to take a dog that's suffering, bald, itching, and 3 months later, it's a very happy dog. So, we're on to the summary. Oh, not quite. There's a scabies mite in cats too, called Notoides cati. We don't see this in the United Kingdom. This is what it looks like. This is a case sent to me from the Czech Republic. I looked on Google the other night to see whether Notoides exists in Turkey, and as far as I know, it does not. But my Turkish colleagues will put me right if that's not the case. It tends to occur in pockets over continental Europe. It doesn't occur in the United Kingdom. But when it does, it causes immense itching and crusting, as you see here. So the summary, what I've been saying, in the time available. As far as flea bite hypersensitivity is concerned, it's not difficult to recognize. Nearly always you get the lesions on the back near the base of the tail. Lesions along the back. But the fleas are often difficult to find. That's because the dog is licking and scratching and hypersensitive and getting rid of the evidence. But you will find them if you're very careful. And it's actually not that easy to treat. It ought to be easy to treat. All you've got to do is use a licensed product and do it religiously the first day of every month, and that's as much as you can do. I don't use too much environmental treatment. I like to treat them by using the animal to kill off the fleas. But there may be poor compliance. People forget, or they can't be bothered until they actually see fleas. By the time they see fleas, there's probably 95% in the environment in the pre-stages. But there are many good products. With sarcoptic mange or scabies, it's easily missed. Unlike the flea bite hypersensitivity, initially it looks like an allergic skin disease. It's not that itchy. They scratch around the face as they do with atopy, with allergic skin conditions. starts around the ears. The mites are difficult to find. Again, this is because of hypersensitivity and getting rid of the evidence. But the key to it is, compared to fleas, is it gets worse and worse and worse, starting off with 0 out of 10, starting off with 3 or 4 out of 10, ending up with 10 out of 10 if it's not treated. But it's easy to treat. But the way to treat these is not to rely on the owner. You make sure that you yourself, as a vet or a nurse or somebody who's suitably trained to use the product and do it properly.